My name is Dr. Mark Hong, and I'm a urologist. Well, BPH is a very common issue. In fact, it's the most common reason why men come in to see me. BPH, of course, is a benign or non-cancerous enlargement of the prostate. So, as you get older, the prostate gland grows. It can cause you urination issues, such as a slow stream, getting up at night, going often, and feeling like you're not emptying yourself completely.
Well, my symptoms first started when I was in my late 20s, and that was my first dealings with the prostate and my issues. And I've been battling that since, into my late 50s. My symptoms basically were discomfort, frequent urination, especially at night, and an urgency to urinate. And that was my symptoms early in my 20s and 30s and 40s, and in my 50s my symptoms changed a little bit. I'd always been on antibiotics or Cipro, which had seemed to have worked and solved my issues temporarily and give me some relief. But last year I noticed that the Cipro it stopped working. My Cipro, the antibiotic I was on, stopped working, and my symptoms worsened. Difficulty urinating, numerous trips at night.
But the truth is, most medicine doesn't cure the problem, okay? So it might help with your symptoms by relaxing the prostate, but it doesn't get rid of the problem forever. My
symptoms had worsened to the point where, yes, it did impact my personal and family life, and even my professional life. Personally, I did not want to go out. I would try and sit at home or relax and lay down. I'd lay down on the floor trying to get some relief. I did not want to go out and be around other people. Wasn't in the mood. I felt bad, and I lacked motivation to do anything, and that started impacting my professional life.
Also, a common complaint is that guys feel like they're getting up often to use the bathroom. So they might be getting up twice, 3 times, even every hour for some guys. And then when they go to the bathroom, they feel like it's hard to urinate, or it just takes them a while to empty. And they might not even feel like they have that much in their bladder when they actually pee. So it totally messes up their sleep, and then they're miserable because throughout the day, then they're tired. One of the most exciting things is something called a Urolift. Urolift is a relatively new procedure, and we've had it for several years now, but it's a very minimally invasive way of opening up the prostate in order to get your stream open and therefore to fix this problem of BPH. The Urolift involves the placement of several implants that go into your prostate. These implants are kind of like small clips. Over the dozens of Urolifts that I've done over the last several years, I've seen a dramatic results in terms of what we both measure objectively and also what patients are telling me subjectively.
I came across Dr. Hong in Arizona. What caught my eye is he had an informative video on explaining the procedure. I knew that he was well versed in this procedure, and that I thought, this is the doctor I need to talk to, I need to see, and so I set up an appointment to go see him and dropped in, and I wanted to see if I was a candidate for the Urolift. The main thing that the Urolift appealed to me were the no known side effects, because the other procedures that they use and have traditionally used, which is what my urologist was well versed in, it was the TURP method, which is, to me, is almost a barbaric surgical procedure. The chances of having adverse side effects was a lot higher, and this is what drove me to the Urolift, the lack of side effects. And even though it was a new procedure, I was willing to try it because I understood that the procedure, if it didn't work, it would not prevent you from having other procedures. So I knew that this was the procedure for me.
So one of the major advantages of the Urolift is going to be its impact on sexual function, or to put it another way, its non-impact on sexual function, because it's really one of our best treatments for BPH that doesn't impact sexual function.
So I stopped in, and here's Dr. Hong, and I explained my symptoms to him, and he immediately began running the test and ruling things out, and he decided that I was a candidate for the Urolift, and he performed that procedure. This procedure, the Urolift, I was at my wit's end. This has given me a whole new attitude toward going on. I was miserable. I was miserable in every aspect of my life, and I just can't say enough about this procedure. The positive impact at this point it's had on me. 0 side effects. I can't say enough for this procedure. I have to encourage anyone that is having issues, find you a doctor, seek out a doctor, do some research on this Urolift. It is absolutely amazing. No side effects, and it's not gonna cause a problem if it doesn't work for you. It's not gonna prevent you from having further surgical procedures. What have you got to lose?